Hello, I'm Dr. Carol Benson, representing myself and my colleague, Dr. Irina Iwasaki. I'm just talking to you in this video about some preliminary results from phase 1 of our evaluation of the Aleph program. So the big question for us is, in the field, is whether or not literacy equals empowerment. If you gain reading and writing skills, does it automatically empower you, or are there some other things that need to happen? And we think that's a really good question for Aleph to answer with this data that they've given us to analyze. So with this evaluation, our goals are to offer some insights for Aleph and its partners regarding how the program may be contributing to improving participants' lives, and also provide Aleph with some systematic and credible data on what participants are experiencing as a result of the program. In this case, we're working with testimonials, what Aleph calls testimonials, which are participants' statements given voluntarily about something that has changed in their lives. They were asked a question, something like this, but in their home language, so we don't know exactly how it was asked. And then they had an opportunity to answer this question. So the database that we're working with is all of the testimonials collected by Aleph in 2023 from the Democratic Republic of Congo, from Togo, and from Uganda. So we have a total of 303 individual statements by many women and some men. And then we also have some statements, 152 of them made by groups. And all of them are in Aleph courses, either level 1, 2, or 3, depending on how long they've been in the program. So our research questions, the ones that I'll focus on today, are to what extent can the changes described by participants be directly attributed to specific aspects of Aleph's program? Like, can we say this aspect of the program caused a change in the person's life? And then we also want to look at strategies used by Aleph to bridge that gap between literacy and numeracy skills learning, and then what might happen along with that in terms of some kind of empowering skills or improvements in health or income. We also developed some specific research questions by theme to guide the coding of the data. So we took all the testimonials and we coded them if they got a certain code. If they were talking about empowerment or improved health, they got a different code. If they were talking about income generation or improvement in their financial situation, etc. So these were some of the categories that we were coding for. We had about 9 codes and a few subcodes under each one. So here's some of the results. We used a qualitative data analysis software. So when we were coding, we were putting that into the software, and it gave us some very interesting results that I'll show you in a second, and helped us find examples of different themes. So the first result we found very quickly was based on codes co-occurring. So a testimony that's been coded for having learned something from a certain Aleph lesson, and then one of these other themes. So you can see from this word cloud that learning something from a certain Aleph lesson was mentioned many, many, many times with regard to changes connected with all of these different themes. I can show it to you in another way in a chart. So this was, again, the code co-occurrence. So that column with all the colors in it, learned from an Aleph lesson. And then you can see that there were some people who talked about learning something about their health and health of themselves, health of their families, and then business, even confidence, and some improvement in agriculture. And you can see from the red co-occurrences that especially the lower one where it says 17, there was 17 people that reported changing something about girls or their children's education due to an Aleph lesson. So we think these co-occurrences are very significant and show that Aleph's choice of lesson topics is very relevant to people's lives. Then just to give you a few examples of things we've been finding, and I'll take what we think is probably one of the most important ones, has to do with self-efficacy, confidence, and women's empowerment. Those are all things that you want to see as a result of a literacy program. But what we found is that people are associating these things with literacy, but also with something that they learned or discussed in an Aleph lesson. And you can see standing up for their rights, gaining financial independence, public speaking. And then the last category mentioned on this page is changes in men's attitudes. So we have some really nice examples of men saying that they became more aware of gender inequalities. For example, sending their boys to school and not their girls. And they've learned something about how important it is for girls to be educated. And also there's some things about supporting their wives. I'll give an example in a second. Oops, sorry. So these are a couple of different testimonials that have to do with literacy, confidence, and rights. These examples, one comes from Togo, one comes from Uganda. In the case of the Togo testimonial, it's a woman who realized that her husband wasn't depositing the whole amount that she gave him to deposit in the bank, and now she does it herself. And another woman in Uganda who was experiencing harassment in the workplace, and when it says during the discussion, that means the discussion that was part of the Aleph lesson, she told her fellow participants that story, and they encouraged her to report the man, and she did, and disciplinary action was taken. Another example is a cross between an Aleph lesson, gender, and health. So this is from a man, and he says that he didn't realize how important it was to accompany his wife to medical appointments when she's pregnant. And it looked like they both had some kind of infection that they needed to take care of. So this had a very nice outcome, very important outcome for both of their health. Another example was challenging deceit. A lot of vulnerable people who are not very literate are taken advantage of in different ways. And this woman talks about having thought that she had to pay the nurse to get access to hospital care, and found out through an Aleph lesson that that was considered a bribe and it's not necessary, shouldn't be necessary to get health care. She also mentions two other things there, that she learned to give prescribed medicine in the proper dosage, and also not to keep expired medication. And finally, I'll just give a couple of examples from the DRC about the importance of literacy in your home language. There were examples from the other two countries as well, but I just had these three ready to go with some different goals that people had for using Mashi in their literacy practices. So one was writing a receipt for a goat that was bought and sold. One was reading messages on a mobile phone, and one was representing her community church group, because she can now read and write phrases from the Bible in Mashi. So there are a few implications for our wider evaluation. One thing that we're going to try to do is to ask participants about the relevance of lesson topics to their lives. We think we see that already, that they're very relevant. We're also going to look more closely at the discussions, what happens during those discussions in their classes. and how do participants get inspired to change things. And so that's to be continued. We'll be looking for different indications in the evaluation to come. Thank you very much for your attention, and hope this has been helpful to you.